Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking with Orthopedic Surgeon Dr. Daxton Steele about arthritis, a very common but treatable complaint that often comes with aging. Next, we'll be discussing the West Florida Area Health Education Center's Healthy Aging programs and how you can participate. Finally today, we're entering our birding era for a check-in with our local Audubon Society chapter. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. In the United States, the CDC estimates that 58.5 million adults have arthritis, and projections suggest that this number will increase to 78 million by 2040. Here to talk more about the options for treating arthritis is Dr. Daxton Steele, an orthopedic surgeon with the Andrews Institute. Thank you for joining us today, Dr. Steele.
Thank you.
So first off, what exactly is arthritis?
Well, arthritis by definition is inflammation of a joint. Most of the time the inflammation is caused by cartilage loss, which we call osteoarthritis. There are other types of arthritis, but that's the most common we encounter.
Okay. So what non-surgical treatments are there, and what are the typical results of those?
So typically we try to reduce the inflammation in the joint as best we can. We can do that by activity modifications, by patients using that joint a little less than they usually do. We use walking aids such as walkers or canes to help them offload the joint a little bit. We can use pharmacotherapies or medications such as anti-inflammatory medications like over-the-counter ibuprofen, over-the-counter naproxen, and sometimes we use prescription medications that do the same thing. And then finally, we can do injections directly into the joint, which provide medication right at the source of the problem.
Gotcha. So at what point should someone decide to have surgery?
It's a very personal decision that a patient should have between themselves and the surgeon. Obviously, we like patients to try non-surgical things first to see if we can get their pain taken care of that way. But if those start to fail and the patient's activities of daily living are really hindering what they can do, maybe their job, maybe taking care of themselves, then we start to think about surgery.
Okay. So what type of implant is used in surgery, and what are the kind of pros and cons of that?
Well, I specifically do hip and knee replacements. You can do joint replacements of a lot of different joints of the body, but that's my personal specialty. So right now, the implants we use are basically metal that go into the bone. They can be put in the bone two different ways. One way is through what we call a press fit system, where the implant goes into the bone and the bone eventually grows into the implant. But we also can use bone cement, where we glue the bone to the actual implant. And then intervening between the two metal implants usually is some type of high-grade polyethylene, which is basically very hard plastic, which acts as the new cartilage for the patient's joint.
Wow. So what can a patient expect during the surgery itself?
Well, anesthesia is a big part of this surgery, obviously, getting the patient comfortable before, during, and after the surgery so they're not feeling anything. But we also want to make sure that the patient can start moving and start awake from the surgery very quickly. So working with our anesthesiologist is very important. After surgery, we like to get our patients up immediately and have them start walking and moving the joint, just so that they can know what it feels like after the surgery is finished.
Okay, and so you're talking a little bit about this part of it, but what kind of rehabilitation is required post-surgery?
Well, after surgery, we want to get this joint moving very quickly. We want the patient to sort of feel normal as soon as possible. But unfortunately, there is some pain associated with this surgery, so us and the anesthesiologist do our best to control the pain and get the patient moving. We also work with physical therapists who help the patients walk, who help the patients move the joint appropriately, and also help us monitor how the patients are doing.
Are there any lifestyle changes that patients need to know before and after the surgery?
Obviously, we want patients to be in the best shape possible. I think that's probably the biggest thing we've changed in the last 10 to 15 years in terms of joint replacement. Before, we would just take patients when we thought they were ready. But we're learning there's some things we can do for the patients that really help their surgical outcome and their rehab after. One of which is optimizing their medical problems such as diabetes, high blood pressure, any heart issues. And another thing is making sure their weight is optimal as it can be, because that affects how well the patients heal and how well they do after surgery.
Okay, so getting them kind of in the best possible shape and physical condition they can be in before the surgery.
Yeah, this is an elective surgery. This isn't oftentimes urgent or emergent. So if we have the time to get the patients ready, we should do our best to make sure they're in full best shape.
Absolutely. So what are the signs of complications to watch out for during surgery?
During surgery, obviously, we monitor the patient's blood pressure, their heart, their breathing, which is very important. After surgery, we want to be very careful that the patients don't develop an infection, don't have any wound problems. So we're constantly laying eyes on the patient, either us, a nurse, and or the physical therapist, to make sure the patients are doing well. We also do a good job of monitoring them. We have a lot of great apps that we use with people's iPhones now that patients can be checking in to tell us how they're doing, to keep a sort of 24/7 watch on our patients.
And how does the surgery impact daily life and activities?
Well, after you finish the rehab and after you sort of get back to normal, patients will often say that their lives have really changed. They often can't believe how badly off they were before the surgery. They can go back to playing a lot of different sports, go back to walking, go back to exercising, and this can be a very life-changing surgery for a lot of patients.
And tell me a little bit more about that physical therapy aspect of it.
So for the patients, obviously when you're operating on somebody, you're going through tissue, skin, muscle, and that tissue is damaged, and therefore it's inflamed and has pain after surgery. So managing that pain while still moving it can be very difficult. So patients sometimes do this on their own, and we can guide them through that process, but oftentimes an experienced therapist can really help them learn how hard they need to push it on a day-to-day basis in terms of moving their knee or hip, in terms of walking on it, and they can just push them just that little bit every time that'll allow them to heal quicker and better. And
how does someone know whether what they're experiencing, if they're having knee or hip pain, when is it time to talk to a doctor about it, and when is it just kind of the aches and pains of getting older?
Usually with end-stage arthritis, it's not very subtle. Mm-hmm. Most patients that come to see me have had long-standing pain. They've been dealing with it for a long time. Very rarely will I get a patient who just started noticing this pain, because as you said, most people will manage the early stages on their own, mm-hmm. but they'll get to a point where it's just debilitating to them, and they need to have some intervention. And oftentimes when it's time for surgery, they're at the point where they don't want to try anything else. They're ready to move on, and they're almost demanding the surgery.
Mm-hmm. Gotcha. Well, thank you so much for sharing this with us today.
Thank you for having me.
Next up, we're talking healthy aging programs, from Tai Chi to caregiver support. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better, with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. all when you need us most. Let Baptist make it better. Baptist Healthcare.
If you're looking to make a change to improve your health, it can be difficult to even know where to start. The West Florida Area Health Education Center may be the solution for you. With an array of informative programs for differing wellness needs for older adults, they can provide tools and training to age well and stay in good health. We have the Healthy Aging Program Education Coordinator, Jennifer Van Dyke, here to tell us more. Thanks for being here today, Jennifer.
Thanks for having me.
So first off, what's the mission of the West Florida Area Health Education Center? It's quite a mouthful. And what's your role there?
It is a mouthful. So our greatest mission is just to help improve the health of the people in our communities and surrounding area. We do that through several different programs, but the one that I am part of, or that I head, is the Healthy Aging Program. So what I do is find sites for us to be able to bring programs, and we also have virtual programs as well as on the phone. But then we bring 5 different programs to 4 counties in our area. That's Escambia, Santa Rosa, Okaloosa, and Walton County. So our we have those 5 programs, and I can tell you more about them if you'd like to know.
Absolutely. Tell me what the 5 programs are.
All right. So one of our most enjoyed programs is our Tai Chi for Arthritis program. And it's not just for people with arthritis. However, it has been proven to help decrease pain for people who have arthritis. It also helps to prevent falls and improve mobility and flexibility and just keeping up your strength and all of that as well. Then we have a Living Healthy program, which is done typically through phone calls, and we have also done it virtually on Zoom and in person. And this class is for anyone who's living with any chronic conditions, and it helps them to set goals and plan better healthy eating and exercise and just kind of set themselves up for the most success that they can have in life. Then we've got our Powerful Tools for Caregivers class, and it is for caregivers to take care of themselves. Instead of joining a class to help them know how to be the best caregiver, it's a class that helps them to take care of them, because that is often left out. I've had people sign up for it, and then we start the class and they start weeping because they thought they were there to learn about how to be a caregiver, and they're like, but this is actually what I need. Then we also have a diabetes program. It's our Diabetes Education Empowerment Program. And with that class, we learn all the things you could imagine about what diabetes is, how to take care of yourself with it and manage your life, and so much more, and also gain support and network and all of that. And then the last class is a Matter of Balance, where we work on balance, eliminating different things in your home and environment that could be potential hazards, and just work on coordination, and so the physical exercises, but also environmental safety.
Nice. So reducing fall risks.
Yes, absolutely.
All that. Well, how do people join these programs? Do they have to register, or do they have to meet certain eligibility requirements?
So for these programs, they are all ranging from 4 to 8 weeks long, and there is an importance to committing to that class. So if someone registers, which it does require registration, then they need to be able to commit to the full class, because our funding comes from the Area Agency on Aging, and in order to continue receiving funding and being able to offer these classes, we have to show that people are really needing the class and coming to it and, committing to the class so that we're able to continue offering it.
So they register, do they have to pay a fee?
There is no fee at all. Every program we have is completely free. We just want you to be there.
Awesome. So it's just that commitment, and you need the program, you're going to use the program, but anyone can sign up.
As long as they're 60 and older.
Gotcha.
Yes.
60 and older. So let's talk a little bit more about the caregivers
Sure.
class that you have, because we also see, we have caregiver support groups. We see the burden that has on people who are caregiving for a loved one. Tell me a little bit more about what that class is like.
Sure. So like I was saying, it's about the caregiver instead of being about the care receiver. So we talk about how to communicate. We learn different ways of communicating with our care receiver, and also with healthcare professionals. And so we talk about communication, we learn how to reduce stress and improve self-confidence, how to manage time and set goals and solve problems. We do weekly action plans before we check in, so everyone's setting goals that are typically a personal thing that they want to do. We always encourage it to be something they want, not something they feel like they need to or have to do, because oftentimes these caregivers aren't doing that for themselves. We also work on gaining skills to make tough decisions in caregiving, and just, you know, honing in on how to gain those skills individually, so that when different hard decisions come up, they know how to handle them.
So a little bit about that health advocacy as well. And where can people go to find out about the programs, like when they start and where they would go, all that information?
So we have a website. It is West Florida, all spelled out, ahec.org. And on our website, you can find out information about all the classes, and you'll also find my contact information. The best way to know about what's coming up now and how to sign up and all of that is to contact me directly. So I've got my phone number and email on there, and I can text, call, or do email, and that is the best way to find out all of the detailed information.
And that's also where you should go if you're, say, a church or a community center who wants to house these programs as well.
Absolutely. Contact me. I will take care of it from the top to the bottom.
Awesome. Is there anything else you want to add about these programs that people should know?
Just that we're really excited for 2025 and trying to get out into some new areas. We've been planning out our schedule and are excited to get to offer all of the programs throughout the 4 counties. And we're always hoping to be able to get the word out to more seniors, because oftentimes the people don't seem to know that these programs exist. So I'm just hoping that we can reach more and more seniors so that they can take advantage of these opportunities.
Well, hopefully a few people are watching this, and they will be checking in with those.
Absolutely. Thank you so much.
Thank you for being here. Next up, we'll be winging it with the Francis M. Weston Audubon Society. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
When it comes to the great outdoors, the Gulf Coast provides rich ecosystems and unique flora and fauna. Whether you're already a nature lover or if you're a nature novice, the Francis M. Weston Audubon Society is the group to join. Their mission is to promote the understanding and preservation of wildlife and the environment that supports it through advocacy, education, and volunteer projects. We have local chapter president Jim Brady here to tell us more. Thanks for joining us today.
Well, thank you, Emily. Glad to be here.
So first of all, tell us a bit about the organization's mission and how you carry that out.
Sure. Well, you quoted the mission exactly right out of our bylaws. Some people think of us as a bird-watching organization, and we are. But the truth is we are really an environmental organization that is interested in birds as an indicator of environmental health. And I think we're all concerned with the health of our environment.
Definitely.
So using birds Do we have the same birds we had 10 years ago? Are there changes in the bird life? And those are indicators of what's happening around us.
It's kind of the canary in the coal mine of,
very much
of the
so.
environments.
Yes.
Yeah, help.
Yeah.
So tell me about the membership. How do you become a member and what are the benefits?
Well, let me tell you first that we only serve Escambia and Santa Rosa County.
Mm-hmm.
There are chapters to the east that serve Fort Walton area and another one in Panama City. Our chapter boasts about 750 members.
Wow.
And it's hard to tell because our membership's based on one single person, but we may in fact have a family who's getting the membership. So we like to think we have maybe twice that many. Membership is includes membership in National Audubon Society and in Audubon Florida, our state organization. So you get 3 organizations for the cheap price of only $20 a year.
Wow.
Yeah. Once you've joined the national organization, you are assigned to a local chapter. Membership includes a bi-monthly national magazine that is award-winning in photography and articles. We also have a quarterly newsletter that is online, and you can participate in our many events throughout the year. Although we don't do much during the summer. It's just too darn hot, and the birds feel the same way.
Yeah.
They don't want to be active, and there's no point in going out.
I figured this was a good time to have you on because now everyone's going outside because it's nice to be out there now. But what are some of the activities that the group does host, and what are some upcoming activities and events that you're having? Okay, well, we sponsor monthly membership speaker meetings from August through May. We also take everything off during the summer. We have monthly field trips and bird walks. Field trips tend to be something where we get in a car and go from place to place. Bird walks are more like going to along the beach and just strolling and quietly observing. And we encourage newcomers to go on the bird walks. We also have work days on projects such as our project at Bruce Beach. If you go to Bruce Beach, you may notice there's an area next to the creek that has been planted, and that's our attempt to restore natural vegetation to that badly damaged area. Oh, wow.
Yeah.
Where can people go to find out about the activities and register for the activities that are going on?
Well, the best way, I think, for people this day and age is to go to our website, which is fmwaudubon.org. We also have a website, Francis M. Weston Audubon, and they both list all of our activities. The website actually includes our newsletter. And you can learn a great deal about most of our activities on the front page of our website.
And I've been following along on Facebook and seeing all the different events and pictures and things that the group posts. If someone is interested in learning more about local birds and their habitats, which is kind of what drew me to looking into the group, how do you suggest they get started?
Join our chapter.
Of course,
of course.
Step one.
Although it's not a requirement, we do allow non-members to come to our activities. But twice a year we have a new birder class. It consists of 5 sessions with an evening of lecture and then a field trip on the weekend after that. You can also join our bird walks, which are easy walking events, as I've mentioned, near areas that have known bird activity. Buy a field guide. There's any number of good field guides of the birds in the local area or the regional area. Finally, purchase a pair of binoculars. Most of these birds are about the size of my thumb. Many may be as big as a coffee cup. And so to try and pick out a bird from 20 or 30 yards without a set of binoculars is almost impossible. So buy a good pair of binoculars, 8x40 power or 10x50 are both excellent. About $200 investment for a pair of binoculars that you can use the rest of your life.
Nice.
And finally, join a field trip event. which are posted on our website.
Awesome. Well, do you have a favorite Gulf Coast bird or a favorite place to watch birds?
Well, my favorite bird is a barred owl, and you only can see them at night. My favorite place to bird, frankly, is my own backyard.
Oh.
For people who are interested in joining us, so field trips to Fort Pickens during the spring and fall, during migration, is definitely the best place to be. Although, frankly, this fall the weather has been so good that the birds don't actually stop, that they are migrating from the north, and they just keep going on nice days like this, particularly if there's a north wind to help them across the Gulf. The Gulf Islands National Seashore Headquarters near Gulf Breeze is another good place to go. And my favorite for a field trip is Fort Morgan in Alabama. It's just an incredible conduit, particularly in the fall. Birds that are migrating from the north, when they hit the Gulf, if the weather's not so good, what they do is they turn to the west and they follow the coast all the way over to Mobile Bay. And so right there at Fort Morgan is an incredible place for birding.
So right now is a good time to go in the fall season?
We're almost done with migration, but yeah, you can still see, maybe this weather we're having today will help drop some birds down, because as I said, it's been too nice. They just keep going.
Gotcha. All right, well, I'm definitely gonna get out there and check out some of these spots and hopefully join y'all on a bird walk soon. Thank you so much for being here. We'll definitely be keeping an eye on that website and Facebook for the events.
Thanks. We look forward to seeing you at one of our activities.
All right.
No, all of our activities.
All of them.
Thanks very much, Emma.
And thank you for watching. Until next time, enjoy life. You've earned it.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.